I think it's time to let everything up. Because we need to.
I grew up in 38 foster homes and 2 residential schools and one day school. I was like a stone skipped across the pond. Pew, 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 pew.
They just don't believe you, right? They think you're lying. So if they shut the door and you don't come back, they're like, I was right.
There's high rates of suicide everywhere around the reserves, and even with my own parents, that's how they died.
It's all the trauma from all the generations.
That's the complex trauma. That's what we're talking about, of how cultural genocide can really disrupt and interrupt that nervous system.
Nobody that understood my life and said, it's okay, I'll help you.
It's absolutely life or death risk. Sometimes we get 35 calls a day, and when people call for help, it's not because they're thinking about talking about past trauma. It's because they're in crisis, because their past trauma is exploding inside of them.
I got to looking for someone that would support me in my needs. So someone who was familiar with the Indigenous community, familiar with what intergenerational trauma is, but who also accepted the NIHB program.
Hi, I'm Rob Cribb. We've been examining something called the Non-Insured Health Benefits Program. So this is an insurance plan that covers the costs of medication, counseling, health care, and travel for First Nations people across Canada who aren't covered by medical insurance or who can't afford to pay for the treatment themselves. The deeper we looked into this, the more we found problems that are impacting lives.
There are some gaps there. There is the fact that the majority of the counselors that are on the list are not Indigenous. We don't even know how much experience they've had working with the Indigenous community. They've been approved by NIHB, but that doesn't necessarily mean they've had any vast experience.
The process of finding a provider is a barrier, and then to get into the right provider is another barrier.
We do have a long wait list because we only have, a handful of psychologists, registered psychologists that are on that list.
When somebody can't get into a service because one party or the main party is not responding to it in a professional manner, it's almost akin to economic racism. That's how it translates in terms of the frontline service to somebody who obviously is in need for it.
The healthcare providers I spoke to basically said that it wasn't worth the hassle, that they did not want to provide services only to be paid for 6 months later. They didn't want to have to opt into a program.
We talked to more than 60 current and former clients, therapists, physicians, Indigenous mental health care advocates, and they described a system ensnared in red tape, months-long wait times, and cultural insensitivity.
Mostly, they were not Native. Or Indigenous. They didn't understand where I was coming from and how our life was.
And these are some of the most complex, vulnerable people that we see in our offices. And this has to be taken as an emergency.
Yeah, I just figured if they are funded by NIHB, then most likely they have some cultural training, some understanding of the whole intergenerational trauma. And I just remember feeling so let down. How am I ever going to heal if I can't find somebody to help with the process?
We heard stories like Corinda Lee's a lot during our investigation. Patients desperate for help who couldn't find an NIHB counselor, or if they did, the counselor had little or no understanding of colonial history and the related ongoing harm and violence in communities.
No matter how much we need help, we don't get it. We don't get that right kind of help.
I think it's really important for Indigenous people of any background to be able to have access to other Indigenous practitioners that can understand their lived experience of racism or violence or any number of things that Indigenous people disproportionately experience more often that can adversely impact their mental health.
But most NIHB counselors don't fit the profile Dr. Makokis is painting. Our investigation discovered that fewer than a third of all providers said they have experience working with First Nations and Inuit communities.
Their most intimate experience is about their family and their own personal health. They won't be believed that it happened. Not being believed as a victim of violence is one of the most harmful things that can happen to somebody. That further perpetuates the mistrust within the healthcare system, but will prevent that patient from seeking help from other providers who would be able to provide them with culturally informed, trauma-informed care.
For the past 2 years, we've been digging deep into the NIHB list of over 5,000 therapists. We found counselors with serious disciplinary histories and concerning backgrounds.
Yeah, I just got to the point of like, well, taking whoever will take me, basically.
One of them on the list is Dr. Oren Amitay. Amitay is an NIHB-approved Toronto area counselor who was found guilty of professional misconduct in 2020. It was related to a parenting assessment he conducted in a family court case.
I understand. I should not have done that assessment. Legally speaking, he said that was a bad judgment call on my part. I've never denied that.
Amitay is currently facing another complaint before Ontario's College of Psychologists, alleging conflict of interest, appearance of bias, and consent issues.
It was an exceptional situation, and I fully accept the college's findings, and so I'm going to be doing this coaching, or what I forget what they call it, mentorship coaching.
But it's not just Amitay's disciplinary history that troubles Indigenous patients and mental health care providers. Following headlines of unmarked graves at former residential schools across Canada, Amitay posted an article on his Facebook page. It said residential schools, quote, had the intent of educating children, assimilating them into the broader Canadian population, and ultimately lifting them out of poverty. And he reposted another article calling media reporting of unmarked residential school graves a hoax.
He's got no business being in the mental health. Fire him. Fire him. You guys go see those people where these residential schools are. Tell them to go look at all those orange flags all across Canada. All those babies that didn't make it home, or all the people that lived through the rape and the torment. You tell them to come on down and tell those people that, oh, we were helping you. Helping us what?
This is what Indigenous people hear all the time. That statement from that psychologist isn't anything new. We're just told to get over it. People minimize it all the time. And for somebody whose, career is dedicated to validating people's experiences and emotions, I don't think that person's doing a very good job.
We asked Amitay for his reaction to Cheyenne and Kelly. Here's what he had to say.
Anyone who takes umbrage or offense or is hurt by any of these kind of comments, I can understand that. I mean, I deal with trauma all the time, intergenerational, personal, like every type imaginable. So I don't begrudge somebody who maybe sees something and either they misinterpret it or they don't take it in context and everything like that. In the worst case scenarios, like that they completely misjudge something that's said. Okay, so I would never begrudge them for that because again, they are suffering. They're going through pain that that most people can't imagine. So from the start, if anyone says anything, if they have a bad reaction and so on, I fully understand that. But then again, as I said, even when we hear these recountings of horrors, I'm not denying that. I'm speaking about one specific story, which is all these mass graves. Mass graves has a connotation. If I was, if I belong to any First Nations, Indigenous, or Métis peoples, or if I'm part of any marginalized group, if I believe I'm in a country that has, perpetrated genocide against my people or other marginalized people, that itself causes a level of anxiety and distress that I think is irresponsible.
Amitay continues to be approved by NIHB to service Indigenous clients and is listed on the federal government's roster of mental health care providers as an expert on many topics, including trauma-informed care, childhood and sexual abuse, and depression.
And it used to be called the Medical Services Branch, MSB. Now it's the NIHB. I inherited the position of supervising the therapists who work with clients. I have not heard any complaints through either the therapists I supervise.
Dr. Amate wasn't the only therapist we discovered on the NIHB list who had a disciplinary history. Our investigation uncovered several NIHB-approved therapists with disciplinary pasts and therapists who had committed serious offenses, including sexual improprieties and murder. We asked Indigenous Services Canada for an interview to explain how therapists with these kinds of troubling backgrounds got approved to treat Indigenous patients. Indigenous Services Canada turned down our request for an interview, but it did send us this email that says, in part, the NIHB-enrolled provider list is constantly evolving, and the status of providers is checked on a quarterly basis against records provided by regulatory bodies. Providers who have lost their license or have been suspended from practice will be delisted. A health provider may be added back on the list only if reinstated by a provincial or territorial regulatory body.
I think that the government knows that their systems that are in place are doing exactly what they're meant to do. And in my opinion, the systems are meant for us not to be successful and thrive.
Our investigation turned up therapists with troubling backgrounds, but it turned up many more dedicated to trying to help Indigenous clients. But that's when we discovered another flaw.
Well, we're really booked up. You know, we have this waiting list. So our providers right now, we're looking at a 6-month wait list.
Dr. Sheldon told us she couldn't stand to watch vulnerable patients suffer, waiting months for help. So she and her team provided 2,300 free counseling sessions. That equates to an estimated $160,000 worth of therapy, offered free of charge.
How many people are going to be lost by suicide and addictions for the government to actually listen?
Dr. Sheldon told us about the high risk to patients because of long waiting lists. But we discovered another delay. Providers getting paid. Many healthcare professionals refuse to accept NIHB clients because of months-long delays for payment.
If NIHB could do something, they could actually take care of us properly, you know, have the funds paid right away, not making these providers be annoyed and waiting for their payment.
That is on, you know, Indigenous Services Canada. That's on the federal government to fix that bureaucracy so the wait time isn't there.
The IJB contacted 100 mental health care clinics in Ontario. We found just 15 of them reported having one or more counselors who accept NIHB patients. There are roughly 1,300 psychologists, psychotherapists, and social workers. Of those, 98% said they would not accept NIHB. So where are Indigenous clients suffering from mental health issues supposed to go for help? We asked the federal government to respond to the findings of our investigation, talking to dozens of clients and providers about the delays in service, the lack of cultural sensitivity, and claims that the NIHB did more harm than good. In an email response, Indigenous Services Canada said the following: "We are committed to our continued work together with First Nations and Inuit partners to engage on client perspectives and challenges, with the goal of continually improving client access to benefits. The NIHB program remains open to receiving feedback from clients and providers and strives to continually improve the program." Without any specifics offered by the federal government on how these challenges can be addressed, we gave the last word to clients and the providers that we met.
How come I'm not covered and now I got to go through the, you know, print off all these receipts, submit them to NIHB and wait for them to give me a check, which the bank is going to frickin' hold because I'm Native.
They've broken the treaty, basically, and really wish we'd had it back. We wouldn't be in this jam with healthcare for sure.
I think the NIHB program is set up to deter people from accessing services. I don't think that the NIHB program or Indigenous Services Canada truly cares about being 100% accessible.
NIHB needs to either step up or step back. And stepping up would be to create a more accessible, inclusive program that really was clearly committed to the health and well-being of Indigenous people.
It seems like this is on purpose of why NIHB can't fully support our people, and it's to kind of keep our people kind of trapped in this, this little line or fighting for this little piece of pie.
Our people deserve better.